I'm delighted to be the director of ALIVE, our National Research Translation Centre for Mental Health Care. We're looking forward to working together with our universities and communities, government and industry across Australia. One of the key elements of ALIVE is bringing together people from the community, people who have lived experience of mental health conditions, with researchers to co-design and improve mental health care in Australia.
I was part of Melbourne University's Diamond Project for Depression, and because of that I was invited to become part of the Living Labs project. We come together from different aspects of people who are carers or people who are suffering mental illness to discuss ways in which we could improve the way in which mental assistance is rolled out to the public.
Really enjoyed it. Sort of was using my skills, having been a teacher. It was really interesting. It was very affirming to find that people had had the same experiences going through the system as a carer.
Often research comes up with theoretical solutions to problems. However, one step further is gaining the real-world experience from people that have lived experience.
Just being able to talk about experiences really helped open up discussion for what is it in the future that will be designed to sort of accommodate people's needs, and hopefully they don't have to go through those experiences that some of the members were able to talk about and they went through in the past.
I'm leading a theme around priority populations with particular needs. The first test case is Aboriginal and Torres Strait Islander people and the way lived experience of mental health conditions plays out in that population. But there are other priority populations. There's refugees, migrant populations, low SES communities, ex-prison populations. So it's really ensuring that we don't take a one-size-fits-all approach to this work. The burden of illness around mental health in Aboriginal communities is very large, and we've got the best people, the best minds and consumers and communities engaged around the country.
Well, I'll be heading up the prevention stream. Much of that work is actually going to be happening in other settings. So we're going to be building the connection between health and primary care in particular, and education settings. We're going to be looking at employment settings. We're going to be looking at younger children and families and their communities. We still have very high prevalence rates of mental disorders right across the life course. So we need to do something different. And I think this new centre is an opportunity to do something different.
I'll be co-chairing the Intersectoral Policy Translation Committee. We are committed to ensure that the innovative knowledge generated from this centre is actually changing policy, is transforming systems. The centre's an opportunity to really seriously embed co-design into everything we do. We want to bring together the best researchers, people with lived experience, and really bring this knowledge into translation. We hope that this knowledge is a key to drive systems change, to improve the lives and health of people with mental illnesses in Australia.
I'm really looking forward to working with the whole team to co-design the national roadmap for translation of our planned work over the next 5 years with our communities. I'm so excited to be part of this unique opportunity to create a centre that is truly lived experience driven. People with lived experience will be embedded in all of the centre's activities, so everything will be co-designed, where research and lived experience communities will work together across the whole 5 years, from the very beginning to the very end, and at all levels of the network. And this is key to the centre's impact.
I and my family have felt the effects of mental illness. My older daughter Isabella has schizophrenia, so we've come to understand how it feels, the impact on people with lived experience and their families. And for me, it's given me a great motivation to try to help contribute to mental health policy and research. I'm honoured to have the role of Chair of Governance of this special initiative. There are a few governance roles that could be as important.
What a unique opportunity this is to bring together people and researchers across Australia for the next era of mental health care.